I'm Dr. Michael Harbison, and I'm here today to talk to you a little bit about fatigue. As we know, we all tend to deal a lot with fatigue. No matter who you are, no matter what your area or your profession is, fatigue is something that just kind of attacks everybody. What kind of problems are you having? Are you having where you can't sleep at night? Having a hard time falling asleep? How do you start your day? Are you starting your day hitting the snooze button, waking up at the last minute, rushing to work? If you're a female, doing your makeup in the car while you're sitting at the stop sign? All these are the common scenarios of today's society. And what's going on is our lifestyles and our diet, nutrition, our different choices that we make are causing these kinds of fatigues. Now, what's going on with your primary care physician or the medical model as far as these kinds of conditions happen? Well, the medical model is very much, it's in turmoil right now. And part of the reason is because of all the changes with insurance. So you have your premiums are skyrocketing, you're getting a lot less coverage, so it's costing you a lot more money to go to the doctor. The doctors are getting reimbursed less, so the doctors are spending less time with their patients and trying to run more patients through. This becomes a double-edged sword for a patient like you. Patients with these kinds of chronic conditions, they need more time to be talked to, they need more time to be evaluated, they need more extensive evaluation, and most of the time from your primary care standpoint, it's just way too common, so it's just something that you're going to have to deal with. And that's really not the answer. The answer is actually more thorough testing, more extensive testing, and someone actually sitting down who's experienced in treating these kinds of conditions, sitting down with you and getting to the root of the actual cause or the problem. With these chronic conditions, there are many conditions that fall into the category of chronic conditions. You have chronic fatigue, you have thyroid issues, Hashimoto's, Graves' disease, the beginning stages of thyroid issues, so beginning stages of hypothyroid or hyperthyroid, where your thyroid antibodies are elevated or even in some cases extremely elevated, but yet your thyroid's functioning perfectly fine. And on these kinds of patients, it is crucial to find out what's causing those antibodies to increase, because if action is not taken now, sooner or later that switch is going to be flipped and you will become hypothyroid, hyperthyroid, Hashimoto's, Graves' disease. One of those will end up happening to you. Now, there's other chronic conditions such as insulin resistance and diabetes, two separate conditions actually, not one and the same. Irritable bowel syndrome is another chronic condition that definitely needs a little bit of an assessment to find out what's going on, but can definitely be treated. Fibromyalgia, common in today's society. Very good results are obtained through natural health care with fibromyalgia. Very, very good results actually. Once it is addressed and the root of the problem is actually discovered, it could be anything from a gut disorder, digestion disorder, nutrient disorder, all sorts of different things that can be evaluated, or even some allergies cause fibromyalgia. Not just a gluten allergy, but there's other food sensitivities that can be tested for. And if you have been tested for gluten by your primary care physician, hey, that is amazing. That's great. That's one step. But if it came back either positive or negative for gluten sensitivity, that's fine. There's about 26 other cross-reactives that you could possibly be allergic to that are causing these kinds of effects. So it's pretty extensive testing. Chronic pain is another thing that can be addressed through nutrition or different kinds of blood testing and actually finding out the root of the problem. And migraines are huge as far as finding out what the root cause of the problem is. Migraines are not normal. Some people think, oh, I was just a lucky one born with migraines and so that's what I have to deal with. Migraines are not normal. Stop suffering. A lot of these things can be brought forth and discovered at the root of the cause is something that can be discovered through extensive blood panels and different things like that. Most primary care physicians, when they run your blood panel, which is probably going to run you $700, $800, $900 for a standard blood panel or CBC, it tests the very bare minimum of what actually you need tested. If you're having a chronic condition, the bare minimum is not what you need. You need a very more extensive blood panel ran, and also you need a thorough evaluation of that blood panel to actually address how your body's functioning. And that's where functional medicine comes into play. Functional medicine, or what we do here in our office, is we take the blood values and we look at the whole entire body as a whole, and we find out what is your body doing specifically, or what is it not doing, where is it dysfunctioning. And from there we take and we figure out a plan for you. And on top of that, we actually sit down and explain your blood chemistry profile to you, or any other testing that you have done in our office. Listen, you're paying for it. You're paying for your doctor to explain it to you. You're paying for the knowledge to actually know where to move forward from. Most people tend to stay in these chronic states and feel that they're almost hopeless in a sense, because nobody's actually taken the time to sit down with them and educate them about their condition, or educate them about what is going on with their body, and then what can I do to change those things that are happening in my body. Here in our office, our greatest patient is the patient that we empower. Our greatest patient is the patient that we educate about their body. Because a patient who knows more about their body becomes a better patient. It's common sense. If you know why I want you to do X, Y, or Z, or take this supplement versus this supplement, then there's no question. You do not doubt what is being told to you, and B, you're learning about your own body and your own condition, and that empowers you and that gives you strength to be able to battle and overcome that condition. So if you're ready to stop beating your head against the wall, and you're ready to actually start getting answers and ready to start learning about your chronic condition, whether it be chronic fatigue, Hashimoto's, Graves' disease, an insulin resistance, or you could be diabetic, IBS, fibromyalgia, give us a call. Migraines, we more than love to help. That's what we do here. Give us a call, schedule your consultation, and take action to change your life.